Ladies and gentlemen, welcome to Shake It Up, the podcast. This is Steve Brown, your host and moderator. And here for the fourth time, hopefully not the last, we have Marcus, who has just undergone deep brain stimulation surgery. And what we're going to discuss on this one is the initial programming and, good points, bad points, how things are progressing. In my case, I was somewhat unusual that they hit like the sweet spot on the first try, but it's not always that way. And I do want to emphasize that programming these things is a progress. So, Marcus, how you doing, man?
Not too bad, thanks, Steve. It's been a journey. It's been a process. I can say, I'll start there where you're talking about the programming. As far as sweet spot goes, from what I've read, it takes anywhere up to 6 programming sessions. Myself, the first session, they got probably, I'd say, 70% of it. I had my second session yesterday. The trick is, and people watching this, when you go through it, it's a very grueling experience. At least my side of the programming was. I found in some ways the programming to be more not difficult, but more stressful on the body than the surgeries themselves. I was pretty exhausted after it. It wasn't anything bad. I don't mean to alarm anybody saying that. It was a very they set the baseline for where your tremor, your high point, your low point of the device. Not your high point, but your higher point. And it was very intensive. And so for me, very tired. Take time off if you're still working. Take time off the day after, the days after, because it's a very intense process. I started my leave from work after the programming or at the programming. And, that's one thing I want to call out here is I'd probably start it sooner. I tried to work through it, but I'll be honest, it's very, between the surgeries and the programming, it's very tiring. And, I'd say probably one piece of advice to people watching this is take time off a little sooner, take a leave sooner if you can.
Okay, well, at this point, I want to jump in and remind everybody um, there are different flavors of deep brain stimulation or DBS surgery. I had the all in one package, and Marcus was three separate surgeries. Then, as a fourth and final step, had the activation. Now, mine was essentially two steps. They put everything in place, the electrodes, the monitor, and then we waited 2 to 3 weeks. I forget exactly how long eh, for activation. That part of it is identical to Marcus, and uh, and you indicated you said 70% the first time through.
Yeah, I'm just giving an estimate. I'd say the tremor is, it was stronger in my left hand. It's probably about 60% or 40% gone in my left hand. In my right hand, it's probably about 75, 80%. I'll jump in there and start talking through it. You can see I have good mobility with my right hand. I'm able to drink now. Before I had this whole process done, I was drinking with two hands. Now I'm drinking with one hand. Minimal tremor when it comes up to my mouth. Very minimal. Yeah, I mean,
Let's hold the hand up. Let's.
yeah. It's my. This is my right hand I'm showing now, and it's the
Okay,
tremors.
let's see. Let's see the left.
Left hand is pretty much gone. There's slight tremor, um, one of the things I'd share with people is I find the tremor to be postural. And what I mean by that is at certain points, the tremor is stronger when I do things. What I found with the programming and the surgery is, now I'm able to drink with one hand. I'm able to write again. I'm able to do a lot of the things. Texting with my thumb is a lot easier than it was before.
Yep.
I'm not gonna, I still have another one, maybe two sessions. I'm not gonna say things are perfect at this point. When I text, there's sometimes a slight tremor with my thumb. When I poured milk, sometimes I do get a tremor at that angle or when I pour the milk. So it still, creeps in there. I think if I wanted to, or if I were really truly obsessive, I could go through enough sessions to get rid of every angle or every time the tremor creeps in. I don't know that that's that important to me. I don't know. I don't want to speak for all the viewers. But being able to drink again, being able to write again, being able to do those things is a big step for me. That's a big. It makes
Mhm.
the surgery worthwhile. I'll say that. And you know, again, I don't want to mislead anybody. It's not a cure. It's not going to totally, unless you want to just go through 10, 15 sessions, it's not going to eliminate the tremor in every angle or time. But it does improve your quality of life. It does give you your life back in some ways. I'm socially more comfortable in the week since I've had the programming, since I've done it. But it's worthwhile. I'll say that.
Let's talk a little bit about when you first had the programming done, because you and I spoke on the phone and you said you were a little uncomfortable, like sleeping overnight with it on. So you turned it off and then uh, uh, walk us through that process. What was going through your mind at that point?
I did. So yesterday, I see as really truly my first programming session, and I've had two. But to your point, I had a lot of stress at work. I was trying to do too much. I was trying to, work and go through all this, and that I should never have done that. And it really mixed things up and sort of, I don't know, muddied the treatment or the process. And so, to your point, when I had the first session, I turned the device off after the first. I just had a lot of stuff going on in my head. I was thinking through work too much. It was really starting to stress me out, and so the device. What you'll find when you go through the programming is, your first day with it. Don't be alarmed. Don't be concerned, but it's a big first programming. You'll get sensation in your fingers. You'll get for me, I had a very acute sense of smell. That sort of threw me off, and I read other people got that where for a day I could still smell the room. Where I had the treatment done. Dinner from the first night I could still smell for a day or two. Um, don't be alarmed by that. It's nothing concerning. It just everybody treats it different, or everybody reacts differently, and so it gradually went away, but it kind of concerned me, so I turned it off, and then about 3 days later I turned it back on, and everything was good. I was able to. It sounds dumb, but when I go to write a receipt for a credit card payment, I was able
Mhm.
to write a tip and I was able to sign my name, and I hadn't been able to do that in a while.
And you don't realize how huge that is until you can't do it. So you're handing everything to your wife all the time.
Well, it's the small things. I was stubborn. I would still try to do it before the surgery, but this time it was very smooth. I could just write the tip, and yeah, I could sign my name, and it was nice.
Now, let me ask you a question. Before your surgery, because this is something that I dealt with. It's where your hand, you'd have a little bit of a tremor. Let's say you're carrying a cup of coffee and you had a little bit of a tremor, and it would just get worse and worse and worse until your hand was doing this and the coffee was everywhere but in your mouth. With that type of runaway tremor, did you experience any of that, or was yours different?
Yes and no. What I found with the runaway tremor was it was the more you thought about it, the worse it got. So
Yeah,
if I had the tremor, it would be minor walking with the cup of coffee, but if I saw it starting to shake, the more I thought about it, the more I looked at it, the more it would shake, and it became
yeah,
sort of a spiral, if you will. And
yeah.
and so usually I would just take a few deep breaths, calm down, and the tremor would recede. Um, but now, as you say that, I walk through the house carrying a glass of wine, and I'm steady. My hand is steady. I sit in bed and drink a glass of wine, and usually I'd have to wait till the second glass or 3 or 4 sips to get a steady hand, 5 sips.
Hmm.
But now on the first one, it's a steady glass to me, and so it's pretty nice, the small things like that the surgery has brought me back.
Good,
You know, so
good.
yeah.
So now, when you started writing again, I assume you're talking cursive, correct?
Yes, they had me do some writing samples that were cursive, but I also, when I sign my name, yes, I'm writing cursive, and it's pretty smooth. It's different writing again.
Okay. In my case, it was several years, and so I found myself having to um, not relearn to write, but relearn to write efficiently and quickly. And I'm looking at the way that I can write today, and I didn't realize how long this tremor had been affecting my handwriting, which is probably 10, 15 years. Um, but you don't recognize it as such.
Yeah, I haven't been able to write for probably 5 years now. Or
Okay.
I've just avoided writing. I still sign a tip. I still do credit card statements, but other than that, I haven't really written for 5 years. Probably nothing consistent, at least.
Yeah, that's understandable. Um, okay, let's move on because the other thing we basically wanted to touch on three topics today, and the second one was the familial connection. Um, there was a strong correlation on my father's side of the family because his father had it, my brother has it, I have it. And I don't know about his sons. I'm going to have to check into that. But I've got two nephews that may or may not be troubled by it. And the one, it would be a real shame because he's like state champion at snooker or something. I mean, he's that good with a pool cue. But essential tremor would bollocks that up. So anyway, what about your family?
So my family, I don't have as specific of a. Before we go to family, though, I do want to talk about
Sure.
when you do the programming. One thing to be aware of is your speech. I mean, as I'm talking here now, is fluid, and I assume, I don't know, Steve can tell me otherwise, but it sounds the same. But you will have to think through and enunciate words differently. That's the
Yes.
part that's probably a little challenging. Is um, you don't have to relearn talking, but your jaw. Speaking from my experience, my jaw is sort of a little bit off. It's not my tongue. People talk about their tongue, but it's my jaw is what's off, and so that's a sensation you'll have to get used to talking with the device. And I think that was the other reason I turned it off was my talking was I wasn't ready to relearn or think through talking. So just be prepared. That's a little not challenging, but it's a little it's just different, I guess.
Yeah, I experience the same thing. I have to there are certain words I have to enunciate or I will literally say them twice in order to get it out correctly. But yeah, it's and the irony of course is that these electrodes are nowhere near the speech centers of your brain. So they technically shouldn't have anything to do with it, but they know that they do.
Well, that's true. It's not that they're near the speech, but where they come into play, that's why I talk about your jaw, or some people talk about their tongue. It's not your speech that's affected because you know exactly what you want to say, you know exactly what the words are, but your jaw being a little bit like heavy is the word I'd describe, the adjective I'd use, is my jaw was heavy for a couple days,
Yeah.
and that heavy jaw makes it tougher to talk the way you did before. And so what they did with my sessions was they tweaked a few settings and they lightened up my jaw, and I could feel it in the programming.
Yeah.
But finding that that's a little tougher than your hands or whatnot, is getting your tongue or your jaw straight But anyways, I just wanted to talk about that for a moment.
No, and you brought up a good point, I should have asked it. Um, the other thing was, that goes along with that. Oh, and I can't think of it, so we'll come back to it if I think of it later. But it's not a big. Yeah, family.
So yeah, my family knowing about it, it's definitely in the family. I believe it comes through my grandma's side. No, my family. It's not that they avoid it. I think everybody in my family has just learned to live with it. People don't really do anything differently. So my dad has it. Both his sisters have it. Whether their kids, my cousins have it, I don't know. We just don't really talk about it. So it's not something people avoid. If I brought it up with my aunts and they just said, yeah, we have a little bit of a shake, or my dad talks about it. I've got a tremor, but I think the difference is I got it a little younger than they did, and
Mm.
so I've had to deal with it a little bit more than they have. They're in their 70s, 60s, and so for them, it's not as big of a issue. Now, as they live with it longer, that may change. I don't know, but that's just sort of the way we are. Is we just move on and deal with it. I chose to get the surgery. I'm younger. I have a career. I'm thinking about. So um, for me, those pieces were a little bit more important. So, but to your question about the family, I don't really know that I can give you a good answer other than it's in my dad's side, my grandma on my dad's side, and his sisters all have it. But beyond that, I don't know if any of my cousins have it.
Would it be fair to say that your job might have contributed to the earlier onset, or at least the worsening of symptoms because of your age and because of your job?
I don't know that it was my job. I mean, it's a stressful job. From what I've read, and nothing's proven, but there are sort of environmental factors that trigger it, or could lead to an earlier development, or maybe it's just genetic. Maybe some people genetically just develop it later. I don't know. You know, Through my 20s, through my 30s, I never really had an issue. Maybe something stressful caused it to come out. I don't know, but it's it's definitely genetic. I mean, it's definitely in the family.
Oh, yeah.
So
Yeah.
I don't know what. Yeah, I don't know what triggered it. Possibly stress. Possibly drinking. I'm not a heavy drinker, but possibly drinking at an early age caused it to come out more. I don't know, but
There's a podcast, 5-Year-Old Drunks.
yeah, I don't know that I was that young, but yeah, it definitely. I don't know. I'll be honest. I mean, if you read online, there's all kinds of studies about it. Michael J. Fox, I'm sure most are familiar with, has Parkinson's, and he believes it was something environmental that caused him to triggered him to get Parkinson's.
I work with somebody at my high school who has early onset Parkinson's, and he was one of those guys down at Camp Lejeune. And if you watch the commercials, they very specifically say, "Do you suffer from Parkinson's?" It's one of the diseases that they mention, along with a litany of cancers. But Parkinson's is in that mix. So I have to believe that there are environmental factors that are causing uh, abnormalities in your brain. And by the way, it should be mentioned, if you're unfamiliar with the difference between essential tremor and Parkinson's, and this is not for you, Marcus, because you're very up on all this stuff. But if you're unfamiliar with the difference, Parkinson's is about 1/10 as common as essential tremor. And with Parkinson's, the difference why they have so many treatments for it is that they know precisely what is causing it, what areas of the brain or area of the brain. And so treatment is more straightforward. Essential tremor, they have no clue. They still, I mean, they're honing in a little bit, but they are not there yet, and it's gonna be, I mean, it could be tomorrow, it could be 20 years, before they, identify a specific cause or causes. Is that a fair statement, Marcus?
Yeah, I think so. I'll just say a couple extra things, and I'm going to date myself because this podcast will be viewed for in 10 years, and they'll say I was wrong or right. But what I've read is they're closer to identifying the gene, and I think this surgery, in my opinion or my belief, is in 10 to 20 years, this surgery will be obsolete. I think gene therapy, gene editing is probably what is next. And I don't know, when they identify the gene and they can make the edit is sort of the next step. And to your point, I think the studies I've read, different people have different ideas on what's causing it, but they haven't found the one gene that causes it, or they haven't proven it. The last thing I read was they thought they found the gene, but they haven't proven it. And so yeah, I think
Well, that's fascinating because it brings up a whole bunch of questions. Your brain, when you reach our age, is fully formed. You don't get new brain cells. It's not like your skin or other organs that, regenerate every few years. um, so would gene editing even work? Or is it something that has to be identified prenatal and when you're in utero, do they have to do it? It will be fascinating to watch.
no, they're doing it now with people that are fully formed. With the examples would be sickle cell anemia and some other neurological diseases. The issue becomes with those diseases, they're easier to identify because the gene has been identified and they know what the I guess what you'd say the normal gene looks like. And so, gene mapping is the next step. They need to figure it out and map it to the correct gene, if you will, for lack
Right.
of a better expression. But for me, I held off doing this surgery thinking maybe that would happen quicker than it did, and I don't have 10 years to wait because 10 years from now that's
Yeah.
about when I'll retire, and so I think 20 years, 10 to 20 years is probably I want to say realistic, but probably somewhat realistic that you could see that. Because as I talk now, they're doing gene therapy with. They've found quotes a cure for sickle cell anemia. They found a cure for I don't know. They're very obscure neurological diseases. I don't have them in front of me, but they found quotes cures that they have a delivery mechanism. They use the influenza gene, and or the influenza virus, and they
Right.
put that in your system, and it goes to the brain and quotes edits that gene,
Well,
and
that's fascinating stuff.
it is, and I've spoken to people about it, but the problem, and this will get answered 10 years from now, is how do you charge for that? Because the cost for the research and such is so extraordinary. The as it stands now, sickle cell anemia, the cure, as you'd call it, is about $1.5 million, and yeah, it's very expensive, and not many people can afford that. But and the drug companies obviously have a stake in this. I'm not going to be, how would you say, negative and say they don't want a cure, but it's not in their financial interest to get a cure. So there is an issue there financially with the drug companies being resistant to some of these treatments. So I'm not going to start conspiracy
Well,
theories.
believe it or not, I have a cousin who I can ask that very question to because he's a fairly well-known geneticist, and he and I have never discussed essential tremor, but I'm definitely gonna, discuss it with him, and, he's written books on the subject, that type of thing, so that would be fascinating to get an update like that.
If you just Googled sickle cell anemia gene therapy, you'll see all the examples and studies. I mean,
Sure.
I have a friend who it runs in their family, and we talked extensively about it, and I've seen the articles and such. It's a valid, proven cure for sickle cell anemia. Now, does that stretch to essential tremor or Parkinson's or those ailments, conditions? I don't know, and that's the question. But until then, we have this podcast, and we talk about DBS as the only viable, or I don't want to say viable because you have ultrasound is the other, but I think this one coming back to the podcast treats probably 80-90% of the condition.
Yeah, and there is no, and once again, it you gotta repeat it as often as you can. There is no real cure. Even DBS is more or less a palliative measure. It just, it lessens the symptoms, it makes white life bearable. I mean, as we speak, I'm sitting here, uh, making a list, not right now, but, because I'm upgrading my workshop. I'm an avid woodworker, and I can finally get back to that. So I'm really excited.
Yeah, it is exciting in the sense that your normal thing. I'm not, again, like you said, not a cure, but you take for granted the simple things that you can't do,
Mhm.
and really at the end of it, it's easy to look back and say, no, I didn't need the DBS, or I didn't, but it doesn't work that way. I mean,
No.
you're gonna lose. If I was drinking with two hands, what was that going to look like in 5 years?
Yeah,
It gets tougher and tougher, and so if you're watching this and you have you have essential tremor, I'm not going to tell you to go get it, but if you want those things back in your life to be able to drink with one hand and write and such, then it's probably something you should explore and look at
sure.
deeper. But
Okay, so we've talked about the programming, and you think you've got 1 to 2 sessions yet until you get it where you're gonna be, let's just say, happy with it, content. Might be a good word. By the way, have moved my appointment up because personally I am having, and I believe they're related, not necessarily so, but we're gonna prove that out. I'm having some balance issues. Now the balance issues I'm having might be due to lifestyle changes that I've recently made, which might be lessening my anxiety and everything else, which might make, might render the programming not obsolete, but overdone.
yeah, I don't have any balance issues.
Good.
3 weeks out from my first programming. No, I mean, I walk a consistent 5 miles a day. I don't have it. I mean, I'm not going to say they won't come up, but my bigger issue has been my jaw, um, has been a little bit heavy. It's better, and it just takes time getting used to.
Sure.
So yeah, I mean, balance. I know you're not the first, Steve, that's brought that up.
And balance is fairly common, as is the jaw thing, speech, even like word recall is another one that you hear about.
Yeah, I think that's a safe statement. But it's just you just work through with your programmer, get comfortable with them, and I'll just share when I did the sessions, I closed my eyes during them, and I didn't watch her, make adjustments, and I just told her as things happened, and it sounds dumb, but closing my eyes allowed me to focus more on what was going on. It allowed me to, talk continuously as she's doing the
Sure.
programming because it allows her to hear your speech and such. And so I asked her, the first session, the Medtronic rep was in there. I asked to just have it just her and I, so I didn't get distracted or think about something else. It's just for me, just being in tune with whoever you're doing your programming with is what's important. So
So basically what you wanna do is document what you want, where you're at, because not all these things are going to pop into your head as you're sitting in your doctor's office. So keep track of what you're trying to work on. And I'm the type of person, I'm not real quick to make changes to my programming, even though I do have some latitude. But I do have to ask you a question. When you turn yours off and then back on, do you get a head rush?
I do. I do. I've only turned it off and then on once. Now she
Okay.
did once yesterday, but both times, yeah. Head rush is probably a good description. Like
Yeah.
you'll
Well,
feel a wave,
yeah.
like of sensation go through
You'll
your
be sitting there and you go,
fingers.
whoa.
Yeah, yeah.
Yeah.
It's nothing painful, and
No.
just to be clear, nothing in this process is painful. It's just I would use the term uncomfortable as sometimes you know that.
Well, yeah, I can't even say that, but uh, that's probably a fair statement as well. Okay, was there anything else that we needed to talk about today? I don't want to keep this too long.
No, it's good. I'm sure you'll edit it down and such. What I would say is, again, it's not painful. The description I'd use is it's uncomfortable. And just to summarize everything where I'm at, so I've had 3 surgeries at this point and 2 programming sessions. My takeaways are, um, again, what I would tell people, viewers watching this, reach out to your surgeon, ask a lot of questions. As Steve and I have talked about, we had 2 different procedures. I don't know. I have opinions, but I don't know which one's right and wrong. But again, I had 3. He had 1, and there's benefits to that. I don't know that the benefits to mine outweigh going in and having 2 more surgeries, but maybe they do, and that's why I say ask the extra questions. Ask questions.
Well, and it leads back to an old phrase, they call it the practice of medicine. It's not the absolute of medicine. It's not like uh, rebuilding the transmission on a '68 Camaro. It's a lot of I'm not going to call it voodoo because it's based on a vast wealth of knowledge, but there is nothing cut and dried anytime you're cutting open a brain.
No, and that's true. And my doctor, my surgeon, neurosurgeon had a specific reason he did 3 surgeries, and he's a surgeon and he's well trained and he's done several hundred. He had said 500, I think was the number. So he has a reason. But again, those watching this, ask those questions. I'm not going
Mhm.
to tell you because he's done 500 surgeries, he's right, but because he's done 500 surgeries, he knows more about it than I do, and so he gave a good reason, and but that reason, to Steve's point, isn't absolute. I would again just stress ask questions. The other thing to that was, I did what was called the pilot hole, and Steve did what was called the burr hole. That's another question I would tell viewers to focus on or ask details about. My imprint on my head is the profile is much lower than what Steve has. Now, I can tell you as I put my hand up there, I could not really tell where they did the hole. No, if Steve, I'll speak for you, but I assume if you put your hand up here, you can feel 2 bumps or 2 screws.
Yeah, well, they're bumps. The funny part is, you know how your body is if you have something wrong with your mouth, your tongue, it whatever little thing is bothering you, it's exaggerated because of your tongue. Well, same thing up here. Yeah, they're there. Um, they don't. If I look at them, they only really stick up 2.5 millimeters. It's not. It's not this big horn like you would think.
Yeah, no, I don't mean to sound that way. But again, it just goes back to it's one more question or one more set of questions to ask your
Right.
surgeon or to think about.
Yeah. If you're uncomfortable, I can perfectly understand. Why women in particular. With me, uh, I'm losing so much hair up here anyway. I'm gonna have to just start wearing ball caps just to keep the sun off my head, if nothing else, which kind of takes care of the problem.
So no, exactly, and it's just a question, to bring up when you go through the
Mhm.
process. Those would be the two immediate things that come to mind in this. But just again, just talking through the last few weeks, or last several weeks, take leave if you're working. Would be something else I would say. I tried to push it more than I should have. And as talking to people, I'm much calmer now, much more relaxed now that I can actually just heal. And that's something I should have done sooner. Um, the other thing would be the programming. Just be prepared. Like, it doesn't. Once it doesn't get easier, I don't mean to alarm or scare anybody. It just the it's not a physical stress. It's just you're gonna go through a lot more mental, but it's worth it. It's not to say. In some ways, it gets easier because you start to see the benefit
Right.
as you move through it. But in other ways, it's more difficult because it's just, physically you have an incision in your chest. The programming is difficult. Your speech gets affected. Those are all things that you have to, think about. And so,
Well, and understand, and this is for viewers, um, every experience is different. Mine was markedly different than Marcus's. Now, does that have to do with how my surgery was done? I don't know. I really don't. And because we're data points, we're not the answer necessarily. So, but the thing that if you've been paying attention through this process, what you've heard over and over again is do your homework. If you're going in for this, walk in, write them down. Walk in with your questions. Now you know that there are multiple types of surgeries. I knew none of that. I was an ignorant boob, but fortunately, I had an exceedingly good outcome. And I will say this, for me, the most painful part was before the surgery was ever done, when we were going through some of the psychological testing, um, when I found out just how bad my hands were. Um, it's very mentally taxing. The day that they turned on my programming, it's like, huzzah, huzzah, huzzah. I felt great. I felt great. I could have run out and done cartwheels.
well, I'll close by saying, in line with what you're saying, the overall satisfaction rate with this is 95%. I don't know what that's based on, but I believe that. Am I satisfied? Yeah, I'm satisfied. You know, it's a 95%. I'm not gonna say success rate, but satisfied rate. And going to what you're saying there, it's just tricky, like getting yourself to accept that you've got a device inside your body. I
Yeah.
mean that's sometimes a little difficult as well. But seeing yourself to be able to drink with one hand and seeing yourself be able to write, you just forget about it. You do. You really.
Well, and that did happen to me the other day, for the first time since my surgery, which was, a year ago July, so we're June, 11 months ago. Um, I was talking to somebody, and they happened to mention me all the, changes in my life, that have transpired in the last few years because, I had hip surgeries and this type of thing, and the one thing that I didn't mention was my DBS surgery, and they had to mention it to me. "Well, what about your brain surgery?" "Oh, yeah." I'd literally forgotten about it. That's the level of comfort that I'm at, and that I am very thankful for it.
You do forget. That's true. I mean, I'm only 3 weeks out, 4 weeks out, and I've already started to forget about it. I just go about my daily. Like the hard thing for me 4 weeks out is not forgetting about the surgery. It's forgetting about what I can do now.
Yeah.
There were things I just had stopped doing because of the tremor that I
Mhm.
can do now. And then now it's the opposite. I have to force myself to think about, well, yeah, you can do that, or you should be able to do that. And
Yeah.
so that's kind of a little tricky. But as far as having the device, you do forget about it. I mean, I still can't lift stuff. I still can't do because I'm still that close from the surgery. But slowly things are coming back. Things are starting to come back, and so yeah,
Okay.
no.
Well, why don't we just say goodbye there, and then Marcus, stick around. I need to talk to you for a minute. Ladies and gentlemen, this has been Shake It Up the podcast. Thank you for tuning in. If you stuck it out for the whole thing, that's great. Um, just remember that the whole like and subscribe thing is it's not a monetary thing. It's just that is my way of knowing that you're watching and that you like what we're doing so that I will continue to do it. I expect nothing out of this. The reason this podcast started was because I saw a lack of down to earth information. Everything that was put out there was by a hospital or with somebody with skin in the game, and that's certainly not me. So I thank you once again, and talk to you soon. Hopefully, actually, Marcus gave me some great ideas that I'm going to follow up on. So everybody have a great day and be good.